Hi, welcome. I'm Dr. Mary Riggin, and I am here in our second video to talk to you about some of the techniques you can use to get some pain relief in the comfort of your own home. Now, I developed Natural Pain Relief Academy as a culmination of 20 years in practice in acupuncture, which is what I've been doing, practicing acupuncture and Oriental medicine as a form of primary health care for 20 years. And I've developed this program to bring you things you can do at home to help you with your pain. So today, I'd like to discuss neck pain. Now, when something hurts, a lot of times we go right to that spot. And a lot of times, just taking your hands right to that pain area. In Chinese medicine, we call those ashi points, because the patient says, ash, that hurts. And so we can actually take our hands and put them, what I like to do, the base of the skull, right here, and you work your way down the neck. And you can take both hands. You could do this sitting at your desk. You can do this sitting in the car at a red light. And you just go nice circular motions with your hand. And that, a lot of times, just to relieve that surface tension, can bring your pain level down a few notches. But now what about these special magic points that I've been talking about? Well, we use these in the clinic. This has come from a lot of study, but I'm going to show you today a few points around the wrist and around the ankle that can actually help relieve neck pain as well. Now, the reason why behind this we don't have time to go into today, we're going to be covering some of that in our full coursework, but try this. There's a spot on the outside of your hand. So you got the pinky, you go along that side, and if you come to right by the wrist and just sneak it under just a little bit, there's a spot, a depression, that if you rub on that is actually connected up to the neck. And by rubbing that in just some nice circular motions, and now you can go on both sides because you've got these points on both sides. And so you rub on that and you rub. And you move the neck and you can feel it loosening up as you're rubbing it. Now on your hand, there's also a point right around the wrist that's connected up for that neck and shoulders. That is kind of right in the middle. You look for not the bony part, but between the bones. There's a little depression. And you can just rub. Little circular motions. You don't want to jam too hard, but look for that tender spot. You can have these ashi points on your hands that correlate to those ashi points on the neck. And well, what is this doing? Well, first of all, it's bringing attention to your consciousness that, hey, I've got a problem here. Let's work on this. But it also, on a very functional level, will help move blood and oxygen to the area. So as you're rubbing on this, there is a connection up to the neck. And again, in our program, we're going to be going into why that is and what is that all about, so you have a better understanding. But you can try this right now. See how it feels. Now, there's another spot I want to cover, is actually on the feet. Now, not as easy to get to sometimes, but can be very powerful for upper body things. And this one, I'm going to bring my foot up here on the video. It's more on the inside, again, around the ankle, just like we did around the wrist. We're going to be around the ankle again. Now, the ankle, there's a spot here's the bone, the ankle bone. Just in front of it, there's a little depression. And again, you rub on it with circular motions. And rub on that. And it might hurt. Ease off if it hurts too much. But keep rubbing on it. The pain indicates an area that's stuck. And so we keep rubbing on that. And you could just rub on the foot, and you might find a spot, and as you're opening up your neck, as you're rubbing on that foot, it's making that connection. And your body is saying, oh, okay, yeah, I can release this. And so if your pain is more on one side of the neck, then you want to focus on the opposite ankle. And if your pain is on this side, then you want to focus on the other side. If it's on both sides, work on both. So you try the ankle point, like we showed you. You try that stimulating, just rubbing the neck down, like we showed you. You've got the hand point. You've got this point. And try that. This doesn't happen overnight. It's a process your body goes through. And so as you feel the pain, maybe it drops a little bit, and it's enough for you to be able to get moving in your day, but then it creeps in again. Rub them again. It's training, retraining your body to respond to pain in a different way than where it's been. Now, the other thing I just want to share with you, I know we talked about the 3 parts to this program, the pressure points to have such a passion for, because I've seen them work so powerfully. Food can be a powerful thing to use for pain reduction when we understand what types of foods out there can actually cause pain. And I want to tell you, one of the biggest issues I've seen in the clinic over the years is a connection between the use of artificial sweeteners and how it can actually contribute to pain problems. And so over the next couple days, I want you to take a look in your cupboard, see if there's anything with artificial sweeteners in it. We're talking that whole rainbow poison, the blue packet, yellow packet, pink packet, and get rid of that. If you're using diet sodas, if you're using drinks with artificial sweeteners, try just drinking water with some lemon juice. And to do something else, get your body away from that. And again, in our training, we're going to go into why this is such a huge issue and what an impact it can have on your health if you start just getting rid of those things. And stretching, just by having your neck, carrying it straight instead of forward, straight up and down, and just doing stretches. Most people don't realize that they're losing range of motion in their neck until this is as far as they can move. And now I evaluate this with our patients in our clinic, but we need to be self-analyzing what's going on. And so you can gently move back and forth. You can gently bend, gently bend. And again, this can help. If you have a neck problem, if you've had any surgical issues, please consult with your doctor before doing any of these things, especially with the rotating. But the points, you can just press on those, and that's safe. I want to thank you for listening today. It's about all the time we have. In our next video this week, I'm going to be talking about more areas that we can press on to help with our aches and pains. If you have something you'd like me to discuss in the next video, make a comment on this one and let us know. And if we can get to it, we will. If not, jump in on the program. I'm going to be handling all of those specific questions and giving you tools that you can use to help with your pain naturally. My name's Dr. Mary Riggin, founder of Natural Pain Relief Academy. Thank you for listening, and we'll see you next time online. Have a good day.